Welcome to our Fordham Graduate School of Education online information program for our counseling, one of our counseling master's program, which is mental health counseling. So we're really lucky today to have a really very widely ranged group here that can talk with you about the program. And let me introduce myself first. My name is Linda Horisk. I'm the Assistant Dean for Admissions. So without further ado, I'm going to introduce Dr. Joe Ponterotto, who is the coordinator of the mental health program.
Thank you, Linda. Thank you, Kevin and Kelly, for helping us organize this panel. My name is Joe Ponterotto. I'm a professor in all the counseling programs. We have a counseling psychology PhD program, a master's program in school counseling, and a master's in mental health counseling, which is the focus of our hour discussion today. So let our students introduce themselves, then I'll provide a brief overview, kind of a snapshot of the mental health counseling program for you.
Hi there, I'm Alyssa Rodriguez. I am a second year mental health counseling student and also one of the leaders of our student group called SAM.
Hi, I'm Maria Pelosi. I'm also a second year mental health counseling student and I am also one of the leaders of our student group SAM.
And I'm Shelby Remillard, also a second year mental health counseling student and a leader at SAM.
Thank you all. Well, again, welcome to Fordham University. We have about an hour and we want to make good use of our time. So what we thought we'd do is that I'd give an overview of the nuts and bolts of the mental health counseling program in terms of the training, admissions, career opportunities, and then we'll give students some voice to talk about their experiences. Then hopefully we'll have a lot of time for back and forth questions that you have about the program. I imagine some of you have done a lot of research about the program and know quite a bit about it, whereas others of you are just kind of signing on or just learning from the get-go about the program. So I have a brief 8-minute or so overview that hopefully meets all of your needs, at least at this stage of your inquiry into the Fordham program in mental health counseling. And I'm certain students will fill us in for points that I missed. Let me just say that much of our detailed information about the program and the profession is in our 70-page mental health counseling student handbook that Linda Horisk offices can send you if you're interested after this meeting to get more information about the program. Okay, why don't we start talking a little bit about the program and its mission. The mental health counseling program is 60 semester credit hours, accrued over 2 years full-time or 3 years part-time. The program is registered with New York State Office of Professions as a licensed qualifying mental health counseling program, which authorizes and prepares our students for independent practice as mental health counselors in a variety of settings, which we'll talk about in a couple minutes. Critically or importantly, the program includes a 1-year internship of 600 hours at a setting where you have supervision on site and you have group supervision on campus. These internships are in a variety of places, and our students will outline more of those later. But just some examples are mental health clinics, hospitals, medical and psychological centers, college counseling centers, childhood services centers, corporate counseling programs, employee assistance programs, and other areas. The internship is done your second year if you're full-time or third year if you're part-time. A little bit about the mission and emphasis of the program. We have a practitioner scientist training model. So we learn about best practice techniques that are anchored in supported research procedures and validated research empirical work. At the core of our training and experiential model is really a multicultural perspective and a social justice anchor. Our sense is that counseling and psychotherapy really can't be effective unless we can acknowledge past and current oppression of certain groups in society and engage in psychotherapy within an empowerment and justice perspective. A little bit more specific about the curriculum, emanating out of our multicultural and social justice mission, you get extensive training in some core areas: individual and group counseling and psychotherapy, psychoeducation and prevention and intervention models, assessment and testing across the lifespan, so from parent training in early childhood all the way up to gerontological and elderly populations, and a strong emphasis in career development testing and assessment. Within all of these areas, we emphasize multicultural and international perspectives and vigilant ethics-based training. Just a note about our admissions, if you're curious about what's required. Again, some of you may know, but others may just be learning about the program. Our student body reflects the clients that we work with. So the age range is probably from early and mid-20s into our 60s. We have students from various racial, ethnic, religious backgrounds, sexual orientations. We really value diversity and aim to have a student body that reflects the clients and patients that we work with as mental health counselors. Some of our students have bachelor's degrees in psychology and sociology, but many do not. You do not need any psychology courses to apply to the program. Again, we're a cross-section of the clients and patients that we wish to serve. Also, about 25% of our students are mid-career changes, so they've had other careers and now are finding a path in the helping profession to help others, and they've joined us after a profession and a career in another area. There are no GRE or standardized tests required for our mental health counseling program or our school counseling program, if some of you may be interested in that program, and we'll have a separate orientation for that in the near weeks. Just a note, finally, on our graduates. When you graduate, you get postmaster's supervision for 2 years, which enables you to sit for licensure and be an independent, licensed mental health counselor. Currently, our students are working in hospitals, general hospital psych units, VA hospitals, psychiatric hospitals, clinics and family agencies, group and independent practice, private practice, corporate counseling, outplacement centers, employee assistance programs, a number with the VA and military counseling emphasis, college counseling centers, some working in media psychology in terms of television or radio in terms of psychological services. Just a final note, we have our own career counselor just for the School of Education in our program, Abigail Ferreira. You'll see her on the website, and she's a graduate of our program as well. So hopefully that gives you a quick snapshot sense of our emphasis, our training model anchored in multicultural and international perspectives. And now how about we give our students some voice to talk about their experiences in the program, and then we'll open it up so you can ask as many questions as you want to the students, to myself, or to Linda, the Assistant Dean of Admissions.
What specifically do you want
So,
to say?
So generally speaking, what we want to hear from the students is, why did you choose Fordham? So maybe we can start with that. You don't have to go into too much personal detail, but what were the factors that made you make that final decision that yes, I want to go to Fordham? And then just a little bit about kind of what was your thinking when you first came into the program, your expectations versus what actually happened to you. What was your transition like? So let's start off with those two.
Okay, I can begin. I chose Fordham for a multitude of reasons, but one of the stronger ones was that it was very multiculturally based and also very strong with the social justice emphasis, which I didn't find in other schools in the area, and I was moving up here, so that was key for me. As far as what I expected in the program, I expected that there'd be a lot of close contact between the students and the professors, and that there'd be smaller classroom settings as well, and I was not disappointed. We do have a lot of interaction with our faculty, so we're not being taught by doctoral students only. We have a bunch of interaction with the main faculty here, and we have options to do research with them as well. And the classes are pretty small, I think about 15, 20 in a classroom, so you get a lot of personal one-on-one contact. And I guess that I've noticed throughout the years that we're now second years, all three of us, but we started as first years together in the same cohort, and so I've noticed that our first year, or now second year cohort, has kind of become close bonded friends, and for our future colleagues in the fields, it's great to have all these personal contacts, both within the student body and with the faculty and staff as well.
Thank you, Alyssa.
I chose Fordham because I was coming straight from undergrad and I knew I wanted to be in the counseling field, and I just didn't know where. And I really felt that Fordham's curriculum covered all the bases in terms of giving me either pre-practicum experience or coursework in almost, if not every section of different types of age, family, non-family, career counseling, etc., of how to counsel and what to expect. So I really felt that Fordham's curriculum was the most comprehensive, and for me that was most important. And I'm also from New York, so I wanted to stay closer to home to be with my family.
Thank you, Maria.
Similarly to Alyssa, my undergrad, I went to a Jesuit college in Seattle, and so I really wanted to keep up the Jesuit tradition of the social justice, multicultural aspect, and that's also why I chose Fordham to continue that Jesuit education in my master's. I also liked how Fordham's counseling program is psychology based rather than like education based than a lot of programs I was looking into. As a psychology undergrad, that's really what I wanted. I also do like the change now for the coming in class, taking the neuropsych class, which I think is going to be really beneficial. So yeah, and then as far as expectations, also to mirror what Alyssa said, I don't really know what I expected coming in, but it definitely was a pleasant surprise as how close our cohort was. I do like that cohort kind of program where you come in with some people and you leave with the same people and you just really develop relationships, and it was one of the reasons why I chose Fordham too. Really well supported.
Thank you, Shelby.
Okay. One of the things that that occurs in the first year of the program is the mentoring by the second years. So I was wondering if you could explain a little bit of that and how that contributed to your transition as well.
I'll take that one. So we kind of did it a little bit differently this year. We had we contacted Linda for the list of mental health counseling students around July, August, and we started sending out emails. We really wanted to match a first-year student with a second-year student on the basis of not only educational or career similarities, but also personality / outside interests, to also form friendships and bonds outside of school. So what we did was we sent out a very short questionnaire, name, email, outside interests, career interests, research interests, and we sent the same questionnaire out to second year students, and we did our best to match everyone up. And so far so good. We've had a social right after the first orientation in the fall, and then some of the second year students and one of the other SAM leaders actually went to the orientation for internships for the first year students recently. So we really find that the mentor program or the mentor partnership really kind of serves as a student guide, as more of like an extra support system of how to navigate, especially when it comes to internships and different classes. I keep in touch with my mentor, even though she's graduated. She was a year older, so even after she's graduated, which is great in terms of how she navigated now jobs and job finding. So it's a very good thing I think we have here.
So I think what you're hearing is that you really begin to form those networking connections from the moment that you come to one of our events. People connect that way. Some of our new students end up getting apartments together. So it really does, and it's interesting the way that it all unfolded. It wasn't something that was a part of a formal structure, more informally, wouldn't you think, the way it began? And so then what the students themselves have put the more formal structures into it by forming groups. And I have to say that it's been a real pleasure for me to, try and help as much as I can and to watch that whole thing unfold. And it isn't just that it's because they're in the counseling program, and that's kind of where their heart and their head is on this. It has a lot to do with who they are and the mentors that they have in the faculty as well, wouldn't you say? So I don't tell them what to say at all.
And given that the internship is such a vital role in the program and such an important part of our training, the applied aspect of the training, perhaps our students can talk a little bit about, from first year to second year, the whole process of applying for internships. Maybe talk a little bit about where your internship setting is, what kind of clients or patients you're working with, and what the nature of supervision is, and how you feel this year is sort of adding on to your competence and confidence levels as practitioner scientists and professional mental health counselors.
I can start. So right now I am interning at a community counseling clinic in Midtown Manhattan. I'm actually working with my former mentor who has a job there. So she actually prepped me for the interview last spring, and I got the offer for the internship, so I worked directly with her doing groups. But I also work with my supervisor as well. I have weekly supervision, but maybe once a week for about an hour, and I can check in with her or either the clinicians or the social workers or psychologists or mental health counselors. There's everyone there that can go and pop my head in and ask questions. But as far as like the practice and training, my location I think is unique from most of everyone else's because I get to set my own schedule. I get to reschedule my clients at my own time. And I can come in as early or as late as I want, which is unique. So it kind of feels like a private practice feel, which is good for me because that's what I want to do eventually. But it is a community clinic. So I have a whole gamut of clients from psychosis to just being worried well. So they could be like one of us or just really anxious or really depressed. And so I have a gamut of clients that I see. But it's going well. I'm learning how to do therapy, and it's interesting because I'm noticing that everything we've learned in class, whether it's multicultural or assessment, it's all in the back of my head. But when I'm there with the client, I'm learning how to do like actual interventions with the client in the room as we're doing it, and that is a scary feeling. Being a novice, like, am I doing this correctly? But with my placement and with my supervision here on campus, I feel safe, and I feel like if I make a mistake, it's okay because I can always remedy that mistake, and it's just a learning curve and a learning process. But I'm enjoying it quite well. So.
Okay, so I am at NYU's Rest Rehabilitation Brain Injury Day Treatment Program. So it's a little bit different than other mental health counseling settings. The clients are there 4 days a week. It's a group setting, and then they have other individual counseling, cognitive training, also like within their days. So it's a jam-packed 5-hour day for a 20-hour week. I get 1 hour of supervision, but also similar to Alyssa, if anything comes up, say in a cognitive session where I'm working one-on-one with someone, I can pull their personal counselor aside and say, hey, this came up, this is how I've handled it, what do you think? Or just give you a heads up, this might come up when you meet with them individually. So I do feel very supported at my internship site. I did have a few questions when we first started, just get kind of the lay of the land, and Liz Casey, our field experience director, really did help us in terms of just making sure that we had all the right paperwork and everything was good to go before we started, even after we started as well.
Thank you, Maria.
And then I was wondering, Shelby, if you could concentrate, tell them where you're doing your internship, but concentrate a little bit also on that process of searching for an internship site. That is one of the biggest questions that we get from prospective students because they imagine that it's the whole, all of New York that they have to search for this, and you do not have all of that responsibility on your own. So could you talk a little bit about your experience and the search process?
Yeah, so I'm currently interning at Harlem Bay Network Pros in Harlem. Awesome. All adults with severe mental illness. I'm really liking it so far. That's a population I've worked with for a while. In the process, it was between that and an addiction clinic that solely specialized in addiction, which is another thing I'm also interested in. Plus a lot of other backup things. But the way we did it was, Maria just mentioned that we had the orientation for first years about internship, where Liz kind of gave a rundown of like a timeline of what you should do now. So what month is it? November. So November, we usually start telling our mentors or mentees in the first years to like start looking about where you think you'd want to go, or like what population you'd want to work with. I think having more choices is probably better, just because you can find probably anything in New York, which is great and also probably terrifying. But so just developing your ideas, brainstorming, who do you want to work with, what type of setting, because you can get an internship in a private practice or in a clinic or in a hospital. And so developing a lot of that. So we started with that. Also, Liz provides a lot of lists of where everybody who's ever attended Fordham, the list of their internship site. So she has a list of people that Fordham has created relationships with through us. And then also what I found really helpful was the site evaluations that we do as second years, but second years before us have done, that really tell us what was good about this site, what wasn't so good about this site, and how they really like their experience there. That's something I really took to heart. Maybe I was like interested in psych, but I read some evaluations that maybe weren't so positive, and I was like, oh, I don't really think I can work in that sort of situation. Actually, the evaluations helped me pick this one over another one that I was interested in, being that it was like a really great environment and everything. And actually, being there now for a few months, I've found that evaluation to be true. So those really helped as well. We try and give the first years like a timeline, and I've also set up my mentees with being like, I've made Excel sheets and spent like maybe 1 day a week working where it's just internship stuff. It's just sending Abigail my cover letters, my resumes, making sure that all comes through. We keep them connected with the career fairs that are on Fordham. We just had one last week that are looking for internships. So we try and give them as much information, but also be open to questions that they have.
Are we allowed to do internship at our place of employment?
Okay, let me
Yeah.
add and speak to that, and also add to what Shelby said. It's very hard to work full-time and do an internship. You're talking about very late nights or working on the weekend with lots of studying, so it's really recommended that if you're working during the internship year, it's part-time, because you want to really maximize the training and your time at site, because that's very important for networking and future career opportunities. So we really emphasize giving your 100% when you're working with your clients during that internship. If you work in a mental health setting and you'd like to do your internship there, it cannot be a dual relationship. So you can't do your internship where you know folks, where you know the supervisor or the clients or patients from your work role. It has to be in a different unit, a different building of the hospital, say, where you have new clients that you don't know, new supervisors, so that you're seen as a trainee who needs to be trained and nourished and encouraged and empowered and giving full support, and not treated as an employee. So we're very careful that you're nourished and given the time and care you need as a trainee to come along at your level to advance your skills. So if you happen to work in a setting where there might be an opportunity to work on a different campus of the hospital, say, then it's possible, but you need to work it out with Liz Casey and the faculty.
One student in our cohort is also doing that, so she's found a way to separate it, and so it's not a dual relationship, and it's really worked well.
Worked out.
Let me ask you, at your different sites, is there a separate application, or is the application through the school and then you go out on your interviews?
So what I did is we get a list from Liz Casey, Shelby said, of past places that have had a Fordham student. So I picked the ones on that list that were more towards my interests and career focus, and I sent out my resume and cover letter to those places. And depending on their system, I followed their directions. So the place I'm at now called me in for an interview, and then after I got hired through the department, I had to fill out the paperwork. There was another site that had me fill out the paperwork before I interviewed. So it's really, in my experience, it was more up to the individual site. But in terms of like making the first contact, I sent an email with my resume and cover letter.
That's usually how it goes, and then it's like applying for a job. The site specific will give you an application that you send out.
It's also important to know that different settings have different deadlines. So hospitals may want an application by a certain date, college counseling centers by a certain date, so it can vary. But generally, with Liz Casey's support, you are writing your own introduction letter, you're sending your curriculum vitae or resume, usually online, so then it's an individual process.
About the practicum, because a lot of New York schools do that, like the second semester, first year they'll do a practicum, but we have like in-class practicum starting your first semester. So it's paired with our intro to counseling class, where we learn a lot about all the skills that you think you know, like the listening and the basic skills, and then the second semester is paired with our theories class, so that's where we learn how to do theories in the counseling session, where we counsel each other when we get feedback from some doctoral students, which was really, really, really helpful, I thought. So that's our practicum. It's be on site, you don't have to worry about a separate.
Yeah. So the way that's scheduled is it's a 2-class block, so it would be, how many hours? It would be 4 or 3?
It's 4, yeah, it's
4
4
hours
modules, yeah.
in one evening you would do that. So it would be the intro to counseling and the practicum both together. It's a 2-hour block for one.
And the rationale for that, Linda, is to connect theory to practice. So for the foundations of individual counseling, for group counseling, for career counseling, it's a module, so courses back to back. The first course, the theory and research that guides you, and then the second course, you're actually practicing the skills in dyadic or triadic training with supervision. So you have a number of practical experiences before you start the internship. But it's all on site, and there's not a need to do a separate practicum for a semester before the internship. Some programs require that. In New York, it's a little difficult because it's a competitive environment in terms of a lot of psychologists and social workers, and we found it more efficient to organize that training in pre-practicum settings across the different modules. To finish the program on time, so full-time to finish in 2 years or part-time to finish in 3 years, you do need to do a number of summer sessions. So if you decide to join us, we would go over that with you at orientation and with your advisor. So you have the first summer session, usually the third week of May or fourth week of May through June, and then summer session 2 starts the first week of July to the first week of August. The May-June session is 6 weeks, 2 days a week. The July session is 5 days a week, so the classes are a little longer. During the semester, classes are in the evening at 5 to 7 or 7 to 9 p.m. and meet only one day a week. So you can go full-time taking 12 credits, and since the courses are in pairs, you can come just 2 days. So you can be a full-time student, commute to Fordham 2 days a week and get a full 12 credits in, which allows you 3 other days to work part-time, to do your homework, and then eventually to be on your internship site year 2. So we've organized it to make it as efficient and as flexible as possible because we have students with very different needs and responsibilities in terms of work and family. We want to make it accessible in terms of social justice to a wide variety of people with different needs, and that's worked for us for a number of years.
And so the program that when you're in the application, it'll say what term are you applying for, and the only choice you have is fall. However, if you are accepted and you accept our offer and pay your deposit, we ask you if you want to start the program early in June. And so, in summer session. And so you would have the choice then of going either session 1 or session 2 with a max of 12 credits for summer, 6 and 6. But that is up to you. Now, did any of you ladies start in summer?
We did not. We have a few friends who did, and they're still on track to graduate in spring 2016. So it helped them a lot as far as like having less hours during their internship year. So it's solely up to you and what you want to do, what works best for you.
There is an option of taking a 5th course, but for graduate study, even 3 courses, 9 credits is considered full-time in terms of the amount and intensity of work. Most students take 12 credits. If approved by an advisor because of scheduling and you want to maybe graduate on time and you couldn't do a summer session for some reason, with faculty approval, you can take a 5th course some semesters if your record speaks to your being able to manage that much intense coursework. Yes. To be a licensed mental health counselor, the supervision has to be while you're enrolled in the state-sanctioned, state-approved mental health counseling program. So you would have to do a 600-hour internship and be supervised. Let me speak to who can supervise you. The mental health counseling bill and law in New York State is fairly recent, 2006. New York State is the 47th state to approve independent practice and license for master's level counselors. Virginia was the first state in 1977. So the whole field of mental health counseling is rather new still in New York State, whereas social work and school counseling has been here for over a century, as has psychology and psychiatry. There's a lot of social workers and psychiatrists and psychologists, and at this point, New York State is allowing you to be supervised in your internship by either a licensed mental health counselor, a licensed clinical social worker, a psychiatrist, a psychologist, or a nurse practitioner. So right now, you can be supervised by a variety of licensed professionals, but to be licensed as a mental health counselor, you have to do that 600-hour internship. You're registered in a state-approved graduate program. And then after you graduate, you get a limited permit. You're hired as a full-time counselor with full salary, but you still need supervision to accrue 3,000 hours, which happens in about 2 years full-time or 3 years part-time for you to be fully independent practice licensed practitioner.
One is if they're is an issue at the place of internship that would result in the student having to leave? Do they lose the hours they already put in?
Good question.
It is a good
We'll let
question.
the students speak to it as well. We monitor the quality of life and the empowerment and the support of students. Over the years, I've been here 28 years, over the years, there have been times when there was too much chaos at the site, or there was too much turnover, or budgets were cut, and it wasn't a nourishing, empowering training site for our students, so we would help them find another site. All those hours that you put in, supervised hours, count. So say you're there 1 or 2 months, all those hours would count, and then with Liz Casey and the faculty, we'd find you another placement. That's rare where students have left, but if it's not meeting your needs and you're being overworked and not nourished in terms of where you are at your level and supported at that point forward, we intervene to make sure you're being treated appropriately and professionally, and at times we do ask you to switch sites and we help you with that process. So if you switch, all the hours that you accrued count, but you'll still need to continue to get more hours to reach 600 hours at the site, which comes out to about 2.5 days a week across the semester at the site, fall and spring semester. These are very good questions. Thank you for your thoughtfulness and your research on the program.
Maybe you could just talk
Yeah.
generally about, some of the things that
Right. In terms of admissions,
Yeah.
we look for the basics in terms of your undergraduate degree. Sometimes they have grades, sometimes they just have letters, depending on what country you got your undergraduate degree in or what school. We look for letters of recommendation that can speak to your ability to work with others and your potential and motivation in terms of professional training, maybe your discipline and your study work habits. Then we weight your personal statement. And in your personal statement, we look for a number of things. How well thought out is this decision? Because devoting your life to serving others in the Jesuit tradition and the mental health counseling tradition is quite a commitment and quite intense training. So it is something that's well thought out through life experiences, things in childhood, things in high school and as a young adult. So personal experiences, professional experiences, volunteer work, work experience. So we get a sense that if you join us, you're really ready for this kind of commitment and a level of intensity that this kind of applied professional work entails. So if you have previous work, that looks favorably on your application, that you're mature, you have experiences, and now you've thought out why you want to pursue 2 or 3 years of intensive training to have the skills to be a professional counselor. So it helps in terms of your application. And again, there's no standardized test, so this is all done with our individual assessments of your application.
I think there was a question earlier about the GRE. It's not required for the mental health counseling program.
Right, or the school counseling program. The GRE is required for the PhD program, but even that's only one of 8 things we look at in terms of applying to the PhD programs. The New York State law mandates the curriculum for mental health counseling, so it's a basic, comprehensive training as a professional practitioner in areas of theory, research, assessment, practice, ethics, and multicultural. So we don't have specific courses like just on substance abuse or just on, childhood counseling. So they're more generic courses in terms of a foundation and a base. However, within your program over the 2 years, and particularly on internship, if you already know what you're interested in, you can start to target some of your projects, your papers, your presentations, and then certainly your internship to work in that area. I would advise students to be open to a variety of things that you might be interested in. Sometimes students come in and they're sure, as Shelby talked about earlier, thinking about I want to work in substance abuse, but then being open and seeing all the other areas and skills we have as mental health counselors, she kind of shifted to kind of a dual specialty. So yes, if you know for sure what the population or the setting that you want to work on, you can navigate and orchestrate your training to really build expertise and establish a professional niche and reputation in that area to make you more marketable in that area. But that's going to be mainly through your internship setting, what you decide to write your papers on, what you decide to present on and do psychoeducation workshops on. So all of the courses really usually give you flexibility to, within the course topic, to write about something that you're particularly interested in. So you can frame and chart your path in that way if you're interested.
Right. Would they be able to take a course outside of the department? Like, let's say I'm thinking about special education.
Right.
That.
Okay, right now, there are 60 credits and 57 are required because the state is very strict about what they require for licensure. Right now we have one elective, so that could be something that you want to do in social work, clinical psych, counseling psych, as long as your advisor approves that. A lot of our students, they take like weekend workshops or go to symposium and they accrue hours of specialized training in those areas. So you may go to a weekend training seminar on childhood therapy or trauma therapy or substance abuse treatment, and that would go on your resume or your curriculum vitae in terms of bolstering your career opportunities. So there are opportunities, but usually it's extra work because New York State is very strict for physicians, for psychologists, for psychiatrists, and for mental health counselors in terms of the rigor of the curriculum that they oversee. So there's not much room for electives, so often it's extra training.
Right. What's the difference between a licensed psychologist and a mental health counselor? That's another question we get a lot.
There are some similarities, some differences. In terms of similarities, you're both licensed for independent practice. You both can open an independent practice or group practice. You both receive insurance payments from insurance companies. So in that way, it's equivalent. Just like if you were a psychiatrist or a physician, you have a license for independent practice, which opens such an arena of opportunities. The difference is the Master's in Mental Health Counseling is a 2 or 3 year program that's anchored in practitioner science. The emphasis right from the first semester is clinical intervention, practical skills to make you more competent, ethically sensitive, and multicultural aware practitioner. By contrast, the PhD program is a scientist practitioner model. So the science comes first. So half of it is science-based research and theory courses, and half is practical courses. It also is a 6-7 year program, so it's many more courses and 3 externships and internships rather than 1. And that gives you also the doctorate, so you're a doctor so-and-so who's a licensed psychologist. Whereas on the master's level, you're a licensed mental health counselor. So there's a little bit of difference in status, but in terms of your career opportunities, you're licensed so you can work in any licensed kind of practice or setting.
Earlier you talked about the hours of supervision that were required post-graduation, but what do they get first from the state upon graduation?
Fordham University is one of the first graduate programs in New York State to get the license eligibility. As soon as the law was passed in Albany, we applied and we were one of the first 4 or 5 to receive it. So again, you have to get the 600 hours of the internship while you're a student at Fordham. Upon graduation, you apply for jobs as a mental health counselor. Once you find a job, with the job setting and the director of that setting or clinic or hospital, you apply for and are issued by the state, the Office of the Professions, a limited permit for practice. So you're a mental health counselor with an LP or a limited permit. Once you have that limited permit, all of the clients you see and all the work you're doing at full salary, those hours are accruing towards your 3,000. And that happens in every licensed profession. As a licensed psychologist and licensed mental health counselor, I had to do hours after my degrees. A physician has to do hours after their degree. A psychiatrist or attorney has to be supervised sort of after their degree. So that's part of any profession that has that much skill level and that much responsibility. So you get a limited permit that's issued to you at the particular setting. So the setting is approved by the Human Services Department of New York State as a mental health approved setting. Once you're employed there, the paperwork gets you the limit permit, and you start logging how many hours that you're there. And once you hit 3,000, you're eligible for the license. You do have to take a national exam to pass for a license, as do physicians and attorneys and psychologists. You can take that exam as soon as you graduate, or you can wait till you accrue your postmaster's hours. There are different strategies. Some students like to take it as soon as they graduate because the academics is so fresh. All the theories and techniques and the ethics and the multicultural transcendent issues are very fresh from their training since it's so emphasized at Fordham University. Some students want to wait a little bit, have more clinical experience, because half of the questions on the licensing exam involve case studies and very practical questions. So that's up to you and your mentors to decide, okay, do you want to take the license right away or do you want to wait till you accrue more hours? But at some point, with your 3,000 hours and you're passing the licensing exam, you get a big certificate from Albany, just like physicians, just like psychiatrists or psychologists, that says you're a licensed mental health counselor approved for independent practice in New York State.
And that's across all states, different ways of doing it, but you have to have a license in order to do the clinical work.
That's a good point, Alyssa. Let me highlight on the portability of the license. Right now, all 50 states have some form of license for mental health counseling on the master's level. Some call it licensed mental health counselor, some call it licensed professional counselor. The 50th state to get it last year is California. Some of our students who graduated from our program and moved to California are among the first to be licensed professional counselors in California. So all 50 states have portability, but each state is different. In New York State, there's only the written exam. Some states also require an oral exam. So you have the written exam obviously passed from New York State, but if you move to a state, you may need to take an oral exam or do another kind of ethics training specific to that state. Some licenses require only 48 credits. The highest, most rigorous is 60, which we have. So in terms of all 50 states in the union, you have enough credits already. It's just a matter of going through the paperwork in case there's establishing residency for a year perhaps, or if there's an oral exam. Some states require you to redo an ethics training specific to that state because of state-specific issues, whether it's rural or more immigrant-focused. But there is portability. I think from a mental health counseling program, I think we have licensed practitioners in probably 48 of the 50 states, I think.
Summer internships, can they do them in summer?
Okay, so summer internships, in terms of legal protection, when you're a registered student, you are covered insurance-wise during fall and spring semester. So if something should happen on internship, although it's rare, sometimes clients do attempt and commit suicide for our trainees, which is very intense and traumatic. You never know what legal issues might emerge from a trauma. You are protected if you're enrolled in that supervision course while you're in internship. We structure it so you can get all 600 hours just in fall and spring semester. However, some internships require that you start in August because that's when the training is. For some reason, you may not be able to get all 600 hours in fall and spring semester. Say you fall ill or your services are called upon to help an ill family member and you need longer. So if that happens, we can extend your internship in the summer, but there's no course, supervision matched course in the summer, so you'd have to get your own insurance, which we have through the American Counseling Association at low cost. So it's rare, but internships can start or continue into the summer if you need it to get your 600 hours or if the setting requires it. And some settings require it because all their initial training is in August and they want you to be ready to go come September 1st. So we're very flexible. We'll work with you and with the settings, which we have very good relationships with to make sure that you meet their training needs and you're also protected should anything go awry in terms of legal and ethical issues, which on occasion do happen in such an intense practitioner-based profession. Well, off the bat, I mean, we have 8 faculty. I'd say 30% are of color. We also have open gay and lesbian faculty. It's mixed in terms of gender. In terms of the student body, maybe the students can talk more. I would say 30%, depending on which program. So that's my general sense.
I would say a little bit more than that in our current cohort. I think it's really diverse.
Mm-hmm.
We have a lot of people who speak Spanish and English, or their primary language was Spanish growing up, and a lot of people from outside the country as well. We take a lot of international students. I even think us just sitting here is really diverse. I'm Native American,
Mexican American,
yeah,
Italian American.
yeah. So we have a lot of our cohort is very diverse. I would say probably maybe 50%, 40%.
The SAN, the Student Associated for Mental Health Council, where we have the 3 coordinators, there are also two associated positions. One is the multicultural liaison. His name is Lamont Young, and he also, with me, is part of the Advisory Committee on Multicultural Affairs, which is part of the whole School of Education. And our role is to infuse multicultural issues and sensitivity in all aspects, in terms of curriculum, in terms of the aura and receptivity on campus, in terms of serving on search committees, in terms of initiatives, in terms of helping faculty build in indigenous models and cultural issues into their syllabi and their ways of teaching. So I think from the student to the faculty of mental health to the whole School of Ed, there's a real strong commitment. And we have a new dean, Dr. Virginia Roach, who one of her primary missions is to enhance the diversity of the faculty and student body and to embed more of a multicultural infusion into our curriculum and way of life on the campus, so that it actually is a multicultural campus and a multicultural community, not just a multicultural kind of curriculum. And that's a major initiative of the School of Ed.
The other thing that you can do too, Brianna, is to look on the faculty profile pages on our website and take a look at who the people are and what their research is involved with.
Right, and in the handbook, Linda can send that to all of you. It's 70 or 80 pages. It has profiles of all the faculty. You'll see that 7 of the 8 faculty, their major research interests are multicultural issues, racism, prejudice, immigration, acculturation. So there's a lot of vibrant kind of research that goes on that feeds the multicultural service and vice versa. And I think that Maria had a comment as well.
Yeah, just to kind of piggyback off of the previous mentioned comments from Linda and Dr. P. One of the professors that I've been doing research with has a mindfulness and diversity identity labs with 2 or 3 different research projects with different students, and myself, another member of our cohort, and 2 doctoral students just went to the BC Diversity Challenge about 3 weeks ago now. So it is a research interest that the members of the faculty and students are getting involved with as well, if you're interested in doing research in that area as well.
Good point, Maria. A lot of the research teams include masters and doctoral students and faculty. So there's a lot of working across the different programs in a collaborative model and fashion.
If they go abroad, can they do the 3,000 hours in another country?
That's a good question. And one of our initiatives is to expand our international collaboration. We have had a student do a practicum, I think in South Korea a couple of years ago. So the challenge is that New York State licensing laws generally require that it be a New York State or tri-state area kind of practicum or internship. But that's something we can work out with the state. If we can ensure that the level of supervision you get, whatever country it is, on some level meets the requirements, we can work out individual kind of internships. So it's more challenging, but we are open to that. And the state has been open to that in terms of approving something like that. So if you're interested in trying that, we work with you, depending on what country and what the services are there, to hook you up with a clinic and sort of a master clinician there who can do the supervision. A challenge is that some countries don't have a license for this particular specialty area. So you might be licensed by a physician or a psychoanalyst in some countries. So we'd have to work that out. It's more complicated, but it is doable with planning and our communicating with the state.
And I would just like to say thank you very much to them. You're having a very unique experience here that sometimes people only get when they come to an in-person info session. So this is really good. I continue to learn every time we have one of these, and so I have to thank the SAM group because they help me out so much, and this is all volunteer time for them. So I appreciate it.
So thanks.